Have you ever got into this and had to stop this type of surgery to go to regular surgery because of a malfunction?
No, on the malfunction part. This equipment is very reliable. It is rare that it ever says something's not right. And when it does say that, there's actually a reset button, and it does not harm the patient at all. Reset it and pick up again. So I've never had a mechanical or electronic malfunction that made me quit doing this surgery. I have had times where I just couldn't get it done, or sometimes there was more bleeding than I was comfortable with, and I would have to convert back to an open surgery. And the three of us here have done them both ways, so it's really not a big deal to convert back to the other way. But that's also a small risk that goes with every one of these surgeries.
Any minimally invasive surgery, you have to have an open procedure as a backup because you never know. I know two patients that we were going to do lobectomies on that just you couldn't even get a trocar in. They had no pleural space. You know, you can't tell it by X-rays, but they just have adhesions that the whole, and you have to just dissect all that out. You'd never be able to do that either with a video-assisted or robotic way to do it. So you just had to open up to kind of make a space to do it. I had one lady who, it looked, you could see fine, but she just did not tolerate we have to put them on one lung anesthesia, and you had to constantly be inflating her lung to where it was in the way of your camera, so we couldn't do her. But most everyone you can for those. Now there are anatomic reasons why ahead of time that you can't do it with a robot. For lungs, if you've got a tumor bigger than 6 centimeters, you have to make such a big incision just to get the tumor in the lung out. You kind of lose that advantage a little bit. Or if they've got some other diseases that go along with this too. But there are reasons, and most of those you can tell ahead of time. But every now and then, you've got it all set up for doing it, with a robot, and for some reason you can't. That's rare. But it's not because of a malfunction for the. It's usually a malfunction of the patient, or something unexpected. I guess is a problem.